welcome back to Good Day Chicago. The Affordable Care Act was supposed to cut Illinois eligible uninsured population by half by the end. Let me start over for you here. There we go. Okay, the Affordable Care Act was supposed to cut Illinois' eligible uninsured population by half by the end of March 2014. Turns out it only cut the rate by a quarter. This information from a study by the Illinois Policy Institute on Obamacare, or the Affordable Health Care Act enrollment. And here this morning to tell us how these numbers break down is Naomi Lopez of the Illinois Policy Institute. And so we'll be talking about this because it's been a couple of months, right, since the Affordable Care Act went into effect, since people could sign up for the exchange. So let's, Naomi, talk about some of these numbers here. How many people in Illinois signed up, and how many did the state hope would sign up?
Well, the interesting thing is that the federal government still hasn't told us exactly how many people have enrolled in the exchanges. But what we do know is that the law was supposed to reduce the uninsured by half in the state of Illinois. The state has only reached half of their goal, and so they are far short of what people here were promised would occur.
And so what does that mean? I mean, I know that the state got quite a bit of federal tax money, as in we paid our taxes to the federal government. They gave it back to the state of Illinois to try to advertise and reach out to folks to try to tell them, look, this service is available. You can now sign up for health care. $155 million our state got from the federal government, our tax dollars. Do you think that worked?
No, we know that that was absolutely a failure. Not only do we have the costs that came directly, the monies that came directly into the state for promotion and marketing, but we also have the state share of healthcare.gov, which was the exchange. Whenever you add up those numbers, in Illinois, we spent more than $1,000 per person who is now covered. That's an enormous amount of money with very little impact.
Now, of course, it is a huge impact for people that have been able to sign up for health insurance. Of course, that's huge for their families and themselves. This website, is it up and running or still offline? Our state website.
The website is running, but the issue is that it's actually not complete. There's actually no way to pay online for the health care coverage, and people do absolutely need access to affordable health care coverage. There's no doubt about that. But there are so many ways that one could do it and actually provide lower health care costs and more affordability for health insurance through other means, and ways that would actually give individuals and families more control and more choice over their health care options.
And I know the Illinois Policy Institute is a nonpartisan organization, but of course there are people that would have different opinions on what you just said. I want to put that out there. Would you say overall then that this is a success or failure in terms of recruiting people to sign up for the Affordable Care Act here in the state of Illinois?
This has been a complete failure. The original goal was to reduce the number of uninsured by half here in the state by this year. They've only reached half of that. They should be judged by that goal.
All right, Naomi, thanks so much for coming in.
Thank you.
We want to send it over to Mark in the Weather Center. Mark?